Have you ever wondered why a small sore in your mouth that just one T-heel could be something deadly? Yes, I'm talking about oral cancer, a silent killer that often starts with a simple ulcer. Oral cancer is a malignant growth that can develop on the lips, tongue, gums, or inner lining of the mouth. It's one of the most common cancers in the world and often linked to tobacco use, alcohol, and even HPV infection. What makes it dangerous? Most people ignore the early signs, thinking it's just a minor issue, until it spreads. Stay with me because, in the next few minutes, I'll break down the clinical signs, pathophysiology, treatment, and nursing care you must know, especially if you're a nurse, doctor, or medical student. Let's talk about the warning signs you should never ignore. The first is a non-healing ulcer lasting more than 2 weeks. Why? Because cancer cells invade and destroy normal tissue, delaying healing. You may also see red or white patches in the mouth. These are called erythroplakia and leukoplakia, which indicate abnormal cell growth. Difficulty chewing or swallowing happens because the tumor obstructs movement. Patients may report persistent sore throat or ear pain due to nerve involvement. And yes, unexplained weight loss, classic sign of cancer. These symptoms often look harmless in the beginning, and that's why oral cancer is so deadly. If you're seeing these in a patient, never ignore them. Now, let's dive deep into what actually happens inside the body. It all starts with genetic mutations in the squamous cells of the oral mucosa. These mutations are usually triggered by carcinogens like tobacco and alcohol. Step 1. DNA damage leads to uncontrolled cell growth. Step 2. Abnormal cells start forming a tumor. Step 3. As the tumor enlarges, it invades deeper tissues, muscle, bone, and lymphatics. Step 4. Cancer cells break away and spread through lymph nodes in the neck, and eventually distant organs like lungs. This entire process is slow in the beginning, but once metastasis starts, survival chances drop drastically. That's why early detection is everything. Now, how do we fight oral cancer? The treatment depends on the stage. Early-stage oral cancer is often treated with surgical excision of the tumor, ensuring clear margins. In advanced cases, surgery may be combined with radiation therapy or chemotherapy, especially when lymph nodes are involved. Drugs like cisplatin and 5-fluorouracil are commonly used in chemo. Targeted therapies, such as cetuximab, focus on blocking cancer cell growth. For patients with speech or swallowing difficulties after surgery, rehabilitation and speech therapy play a crucial role. Remember, successful management requires a team of oncologists, surgeons, and rehabilitation specialists working together. Finally, what can nurses do? Nursing care is critical for recovery and quality of life. First, maintain airway patency, especially after surgery. Tracheostomy care might be needed. Next, focus on pain control and wound care. These patients often experience severe discomfort. Nutritional support is essential because chewing and swallowing are difficult. You may need to assist with tube feeding. Oral hygiene must be maintained to prevent infection using gentle techniques. Provide psychological support because appearance changes and speech problems can affect mental health. And of course, health education, teaching patients to avoid tobacco, alcohol, and to attend regular follow-ups. Remember, a nurse's role doesn't stop at the hospital. It's about improving the patient's overall quality of life.